Yo, hi everybody. Thank you so much for tuning in and welcome back to my channel once again. Um, Today I came across this video that's so disturbing and I thought I need to make a video about this. This might be able to reach the right ears or maybe otherwise inform people, and maybe we'll find a solution to this because it's very sad that this is happening to us in this country that is with over 30 years of independence. So this is what I came across. It was in the newspaper. A man died while waiting for medical assistance at the Katutura Health Clinic, and that's allegedly the black chain clinic. Guys, number one, this matter have been. It's not the first. It's not the new scenario that's taking place, but these matters have been repeating themselves here and there. And it's not only from the Katutura clinic now, the specific clinic, but we are experiencing a lot of how ill treatment or ill treatment, ill behavior, and like we are experiencing a lot of people are experiencing a lot of unfortunate like situations, like how do I say, like people are most experiencing a lot of this ill treatment from the staff, from the healthcare workers, clinic, mostly the nurses, and it's mostly and it's in most cases it's a private, it's a public sector. You go to a clinic, you go there in the morning as early as possible, because remember, clinics are forever full, because that's where the cheaper that's where it's affordable mostly for most of the people to go get health care or treatment. So clinics are mostly full, né? So you go there in the morning and then you wait in the queue. I have been to the clinic several times. You go there early as possible. You are at the front row, and you can go there around 7 or 8. You can spend your time. I did spend time there, and that was not even in Windhoek. It's Swakopmund and other clinics also I have been to. And then you will find yourself spending like more than 4 hours, and the nurses are just passing by, and one is on their phone, they are texting else, some are in their office just chit-chatting, and that is very sad, guys. It's a few of the staff members that you'll find in the clinics, the public hospitals, that are really willing to assist people here and there. Otherwise, you will sit in the queue for the rest of your day. That's why most people are dying like this, and most of them actually dies at home, because whenever they go to the hospital, you sit the whole day there. When you come across those chairs, those silver chairs or whatever they call it, or whatever color they are, you must know that you are going to waste your time. There's just something, I'm calling out these public servants in Namibia. There's just something from the nurses at the hospitals, from the police officers, some police officers. I'm calling you guys from the Ministry of Finance. Ever, most of the public offices are having staff that are really like taking things very personal. People forget why they are there, forget that being in that offices, you are a public servant, you are there to serve the public, but people are just there, and I don't know what they are taking it like it's their personal stuff. That's why whenever I'm somebody, I cannot take up I can't tolerate bad customer service or bad service anywhere, because I used to be myself as a service provider. Ne? Like I used to be a customer service expertise, or I would say I used to serve people, like coming from the background of hospitality industry. You are there to serve people, and those very same people are the ones that are paying your salary. Imagine a hotel or a lodge without customers, obviously there won't be salary. Yeah? So we are coming from that background of whereby you know that no service, what is customer service itself. And it's so sad, and I'm somebody, it's very difficult for us who have experience in the customer service industry to experience bad customer service. Okay, you believe maybe you're not customers, né? But imagine if that hospital where you work, there's no people coming, there's no patients coming. Obviously, that hospital will not be operating, because there's no need of that hospital being there. Same apply to those offices of like, let me say, in smaller towns. Offices do close down because there's no turn up, or there's no there's no need for it to be operational. But you come to hear people in the public sector, people that are serving in the government offices in Namibia, they are so unpolite. Most of them are really unpolite. I'm sorry. but most of them are really unpolite, and I cannot stand that. That's why in most cases when I come to a place where the service is not good, I cannot, as no matter how good and kind I am, I lose my temper right there. Because I'm just believing like I'm that person that is like, no, if maybe you are not taught what customer service is and nobody made you aware of your attitude at the workplace, I'm going to make you aware. Not to make you look bad, but I'm just trying to bring it to your attention that no, ma'am, here you are not doing right. You are not fair, you are being unfair, you are being rude, you are being unkind. That's why whenever I meet somebody in a public space, mostly in the work environment where I work, whether it will be an office or whatever, I'm trying to be so good enough because those are the people that's why I'm there to serve. So why can't the nurses do the same? Believe me, I'm not the first one to say this, né? But you know, when did you go to the hospital or clinic and then you just get quick service? Either the doctor is serving first the people that are only the what they say the doctor. No, the doctor is only attending to the ill patients. Like I don't know what's the right word, but that word. And then you wonder now, who are you to diagnose me already that my condition is not so critical than the other person? Apart from now wound and cuts and so and accidents, but how do you know that? How can you diagnose me by looking at me? Because people are sick and people are going through a lot, but they are not looking like their problems. They don't look like their diseases. They don't look like their health, but deep down there they are going through a lot. This is really sad that this matter is, things like this have to happen, whereby a gentleman or I don't know, a person lost their life in the hospital in at Black Chain apparently, and then the man died actually, and they were told, and the family were told by the nurses to to drive the body to the nearest police station or something like that. I don't know, but I can't remember what they said. But that's really sad. Without the assistance of the healthcare worker, at least a social worker or something, and they said the man was lying there dead in the car. People have to come and pop and peep like checking at that dead person in the car. Imagine having your family member, your loved one in front of you, dying there, and you are telling the nurses, no, he's busy dying. No, the doctor is only attending to critical matters. Who said his condition is not critical? If only we were doing our work, like trying to work with how do I say, like if the person come, they must be treated, not wasting time and taking time and trying to cut corners and so on. I think these type of things will have been avoided. But I'm calling upon the Ministry of Health in Namibia to really do take off their shoes. This matter is not the first time it's happening. Visit the clinics, they educate, have people rotate, maybe the supervisors or the matron, whatever they call it, so that maybe the work can be done more, because people are either getting comfortable in their places of work because they have been there for long and so on. But it's really unacceptable. The ugliest place one will go to will be a clinic in Namibia, a hospital in Namibia, a public hospital. Because once you go there, you are going to be shouted at, you are going to be what, you are going to be called what, you are going to be given a bad attitude. Like, why? You must tell me one person who went to the public hospital in Namibia and they have not experienced any bad treatment or any rudeness or attitude from the staff at the clinic. It's a few of them that we know that are working in such sector, and they are not giving the patients attitude. They are willing to help here and there. There's in every clinic in Namibia. Mostly there is that person that's known that who is not there. I'm not going to that clinic because there's no one to assist me. People are full of attitude. They forget what they are there for. Their main intention or their main aim and what they think they are there for is their bag. They are there for the bag, not to serve. That's why I think most cases people are supposed to be really rotated. Those health workers must be rotated by the ministry, because for the longer you stay at one place, the more comfortable you become. And you start treating people like nobody's business. It is very sad. Namibia Ministry of Health need to they have to pull up their socks and try to, these things are happening. This happened now where the gentleman died. May his soul rest in peace and may his family find comfort in the Lord. But this is really very, very sad. Yeah, anyways, thank you so much for watching up to this point. Please don't forget to like and subscribe to my channel. Have a blessed day.